Hi, I'm Dr. Jennifer Greer. I'm a board-certified plastic surgeon, and today I want to give you a little bit of information on how to choose an injector. This is a question I see on Facebook all the time, like who's great for lip filler? Who should I go to for Dysport? And getting referrals by word of mouth is definitely a great starting place. But then when you go see the injector, there are a few questions to ask. Just for your reference, nurses and nurse practitioners can both inject, at least in the state of Ohio. So you may see one of those injectors. Depending on their training, they can be amazing. I have 2 nurse injectors who work with me and they're fabulous. That's who does my toxin and filler. But some important questions to ask. How long have you been doing this? And how many patients do you treat for injections a week? Because some people may only do it part-time. So saying, hey, I've been in the business 5 years, but I only work like 2 days a month, they're not gonna have the same experience as somebody who's in the office 4 days a week doing it for 5 years, which are more like my injectors. And then the other question, if your injector is a physician, you can ask them what specialty they are. Dermatology and plastic surgery were trained in injectables as part of residency. If it's a different specialty, then you may want to ask them, where did they train? What kind of program was it? Just for your own information, there's no specific certification required for injections in the state of Ohio. There are classes obviously that will give you a certification, but there's no legal requirement. So it's all basically kind of experience, and then if it's part of your core residency training. If you're seeing a nurse injector, that same question is helpful, but you want to take it a step farther and say, hey, who do you go to if you have questions? Who's your backup? Who's your overseeing physician? And what is their training? The other important question is, are they on site? Because it's legal to have a physician in a different state who's overseeing you as the medical director. You know, in my office, my injectors frequently will come and say, hey, what do you think about this? Well, you know, I had this happen with the toxin. Do you think I should tweak this dose? You want them to have somebody experienced, easily available for questions.